So, right, okay. So let me kind of start off. Welcome to our first online webinar for Answer Cancer. This is our first stakeholder collaborative meeting. So I'm just going to introduce a few things, a few bits of housekeeping, and then hand over to the panelists today. So we've got a really good agenda for you, a really good series of speakers across today. I want you first of all to have a look whether you're on Facebook or whether you're on your webinar, if you're on a laptop or if you're on a mobile phone. I want you to kind of have a look along the bottom. So for those of you who are on your mobile phone, you'll see three buttons. So you'll see a Q&A box, question and answer. You'll see a chat box. That's kind of like an old-fashioned chat room. And then you'll see a raise hand button. So let's have a quick practice of the raise hand button. So those of you who are watching us through Zoom on a laptop or through your mobile phone, can you just raise your hand? Right, so yeah, brilliant. I can see about half of you have found that. Half of you have found how to put it down again, so that's kind of great. So what we're going to do, because you'll have noticed your webcam is not working, so it's only kind of the panelists that you'll see today, the way we will interact is through those buttons, through the raise your hand button and through the question and answer button. So at the end of each panelist, we're going to pause for a little while and give you the opportunity to ask question and answers. And Elizabeth, if you give us a wave. Hello. So Elizabeth is going to manage your question and answers. So it's really straightforward. Ask your question. If you like somebody else's question, and give it a thumbs up. And that way we know to ask those questions first of all. So if we don't have time to answer all of your questions, what we will do in the follow-up emails is we will send out a question and answer sheet. So don't worry, if we don't have time, we'll make sure it gets answered as well. So for those of you who are watching this live stream on Facebook, hello, welcome. It's our first time of doing that. One of our staff, Martin, is valiantly monitoring the comments and who feed in questions. So if you've got any comments as you kind of hear the panelists speak, please make them and give us a thumbs up, a heart, any kind of emoji that you want to let us know how it's going as well. So that's kind of the basics about how to interact with us today. The only other thing I have to say really is that, you know, please treat this like you would any other meeting, be respectful of each other as well, because that always helps. And the other thing really to say is that, you know, most of us are working from home at the moment, so things will happen. So whether that's the parcel arriving at somebody's door, whether it's one of the panelist dogs, or whether it's somebody, hopefully not, turning themselves into a potato and not being able to turn themselves back, you know, give us a little bit of kind of leeway as well. So I'm going to hand over to our first panelist, and that's Jess. If I haven't said it already as well, everything you see on this screen, then we will send out to you as well. So all of the slide deck will be sent out, and copies of recordings of this webinar will be available as well. So Jess, if you give me a wave to let me know you can hear me and you're kind of happy, right? Hi, Jess. Okay, so I'll turn my webcam off, hand you over to Jess, and remember, any questions that you would like to ask, put them in the Q&A box. Okay, thanks.
Okay, thanks very much, Adrian. Adrian's actually going to be controlling my slides for me today. So when I say next slide, you'll understand why. Thanks very much for joining us today. As Adrian said, it's the first time we're trying this online. So fingers crossed everything goes well. So my name is Jessica Patak, and I'm the Programme Manager for Answer Cancer. So Answer Cancer is the working title for the Greater Manchester Cancer Screening Engagement Programme. Next slide, Adrian. Thank you. If you bring them all down, that's great. Oh, no, thank you. So it was recognised across Greater Manchester that there are higher inequalities within certain sectors of the community and worse prognosis for those that were diagnosed with cancer. And there was also lower uptake from cancer screening. So there was an opportunity to develop a new service to engage with diverse communities to increase cancer screening awareness within these communities. Next slide, Adrian. So 4 organisations came together, which is Salford CVS on behalf of 10GM, Unique Improvements, BHA for Equality and Voluntary Sector Northwest. We all came together just to put a bid in because we had a track record for doing work around cancer screening and also engaging with the hardest to engage communities, and have got a good track record for community engagement as well. So we came together, and after a lot of discussion, we came up with the name Answer Cancer. So what the remit of the programme is to promote cancer screening in communities where the uptake is low. Next slide, Adrian. So there are a number of different elements for Answer Cancer. So I'm going to do a really brief whistle-stop tour on each of the elements. If you want more information or you want to clarify anything, I'm really happy for people to contact me directly, or you can look on our website for more information. So I'm going to talk about community engagement first. Obviously, the programme is all about engaging with communities to increase awareness on the 3 screening programmes. So over the last 12 months, we've had engagement with over 1,000 people across Greater Manchester, really looking at empowering people so they know to take up cancer screening opportunities. When COVID happened, we had to really change the way that we worked, and we carried out a needs assessment with the communities that we were engaging with to really look at how we could continue to engage with groups, because most of our work had been done in a face-to-face setting, and we knew we had to engage in different ways. So we looked at new ways of working. So we did a lot of work around engagement with community radio stations, which was a new way of working. We developed a new monthly newsletter called Engage GM, and we also started doing a number of virtual engagement sessions. Going forward, we want to look at increase on our community outreach. Most of the 1,000 people that we've engaged with in the first year have been from BME communities, and we know that there are vulnerabilities across other groups, so we're going to be reaching out into LGBT communities, carers, people with mental health problems, and those with disabilities, and those that live in areas of high deprivation, to get out the message about cancer screening. So we're actually gathering expressions of interest for delivering awareness sessions from prioritised groups, and we're also looking at doing joint work with cancer screening improvement leads. Excuse me. Adrian, next slide. The way that we're actually, oh, that's some of the resources that we use. Okay, thank you. Next slide. Okay, so one of the ways that we're actually working is we're creating a social movement. So we're empowering communities for them to have the knowledge and the skills to go out and do their own awareness raising within their communities. One of the ways that we're doing this is through the Cancer Champions movement. So we have individual and organisational cancer champions. Through the COVID lockdown, we came up with the Digital Cancer Champions initiative, which is looking at taking it online. So it's getting people to utilise their own social media networks to get out messages around cancer screening, cancer signs and symptoms, but also emotional health and well-being. So we're using this network to get information out into communities. We're also doing a number of other initiatives, including carrying out a survey with established cancer champions to look at how they want to be engaged. And we've also done a big piece of work around engaging with faith leaders across Greater Manchester, looking at ways to reach into and engage with communities of faith. And we want to network to improve reach into communities. I've already mentioned that we've had a really good engagement with BME communities, but we need to broaden that out. So what are we going to be doing going forwards? So we have a grants programme, which I'll talk about in a minute, and we're going to be supporting the people that have been successful in grants about recruiting cancer champions. And we're also looking at taking the big pot of cancer champions that we've got, we're over 1,000 now, and we want to try and look at developing super cancer champions. So these are looking at having 100 individuals who are really keen on developing the skills and wanting to get messages out into their own communities. Next slide, Adrian. Okay, one of the ways that we're doing this is about empowering people is through training. So for the first year, we've had over 300 participants who've been on training with us, over 18 sessions. One of the things we do to make sure that we're showing the impact that we're doing is we ask everybody to do a plan, which you'll be asked to do today at the end of this session as well. And then we go back and ask people whether or not they've carried out what they said they were going to do in the plan. And we're finding that's a really good way of getting people and supporting people to carry out what they say they're going to do. So for the next year, we're going to be looking at doing a lot more online training sessions. We've already trained 120 people, and Elizabeth has developed 2 awareness videos, which you might have seen either on our website or had emailed to us. So this next year, we want to train over 500 people over 50 different training sessions. And we also want to train the trainer. So we want to give people the skills that they can go out and run training as well and train other people to go on. Next slide, Adrian. Oops. And there's a lovely picture of Elizabeth, who's our training officer. And those are some of the tools that we use on some of the training. Next slide. Okay, so I've already mentioned the grants. So this is a really good way that we've got for empowering communities and giving them some money that they can go and deliver some sessions themselves. So small voluntary sector and community organisations can bid for either £1,000 or £2,000. And for each £1,000 that they bid for, they've got to recruit 25 cancer champions. For that, they get an awareness raising session from us, which is the CR UK Talk Cancer session. And they also have access to a number of online training opportunities, and they get some merchandise. Next slide. Okay, we've just had the second round of grants, and we had 33 applications, and we had 28. Yeah, we had 33 applications and 28 who were successful in their grants. And while we were advertising the grant opportunities, it was actually when the COVID restrictions started. So we asked people to go from doing face-to-face engagement to move it to looking at how they could use online and social media in order to get the message out about cancer screening and to promote the Cancer Champions project. So we got some really good, really creative bids from that, and I think it's been a really good opportunity for getting bids from other people who wouldn't have thought of applying to us. So we've had a number of community radios that have applied, which we're really looking forward to working together with. We've had applications from across all Greater Manchester and a number that are cross-cutting boroughs as well. Next slide, Adrian. Okay, we want to make sure that we're showing what, you know, so what, we're doing all this work, but so what difference is it making for people? And we make sure that we've got a really strong, rigorous research and evaluation theme across all the work that we do. So the work to date that we've got a finalised evaluation methodology and offer, and that's including a bespoke service for community organisations. We've got trials community research training. So we actually ran this to 28 people and we've got really positive feedback. And we're looking at developing that further and rolling that out. Because we've gone online, we've needed to look at how we capture data across the programme. So we looked at creative ways which we're doing that and bringing that in line. And we're also developing promotional material that can be used across the programme. For the year ahead, we'll be looking at new ways to capture data online. So that's going to be things like doing focus groups and one-to-one interviews using social media and online. We're developing a community of practice for people that are trained up in community research, which will support them in their development. And we're going to also be doing deep dive into the programme across various stages across the year, so we can make sure that we really evidence what we're doing. Next slide, Adrian. Okay, underpinning the whole thing that we do, we have a strong communication strategy. In the last quarter, we've gone live with our website. So you can Google either Cancer Champions or you can Google Answer Cancer, and it takes you to our website, which we really hope that you use. And you can also use it to contact us. We're happy to put information for the people on, and you know, we'd really welcome some feedback on the website. We send out regular e-bulletins to all signed up Cancer Champions, and I've already mentioned Engage GM, which is a new bulletin that we're sending out. We are looking at using new social media channels. For example, this is the first time we're streaming live on Facebook. So hello everybody on Facebook. And we've also set up a YouTube channel. So we are looking at using new ways to try different things out. For the future plans, we're going to be utilising the websites more and developing more tools and resources and quizzes that can be rolled out across the programme and used not only for our Cancer Champions but other organisations as well. And we want to develop training that supports, we want to develop resources that supports our training modules. So that is a real whistle-stop tour from me about the different elements of Answer Cancer. I'm happy to talk to people directly if anybody wants to know more about us, and I'll take any questions.
Okay, so we'll hand over to Elizabeth just to find out if any of you have been asking any questions either in the Q&A on here or through Facebook. So Elizabeth.
Let me get my video. Hi, sorry, I thought I'd started my video. Thanks, Jess, that was great. We haven't had any questions directed to you at this point in that part of your presentation. There's one about digital champions, which I'll let Kirit and Michael answer after their part. And then there was just somebody who was having slight problems with the sound, but hopefully I can hear you and hopefully other people can hear us. So I'm unsure as what to do that. So no questions thus far. Thank you. Right, I'm off. Bye.
Thanks very much.
Thank you.
Thank you. Thank you, Elizabeth. Thank you, Jess. If anybody does have any questions after you've kind of thought a bit more about that, then just put them in the Q&A and we'll come back to them a wee bit later. 2 minutes ahead of time, Jess. Brilliant. Thank you. Okay. So now I'm going to hand over to Kirit and Michael. So Kirit and Michael, if you kind of turn on your cams.
Hello.
Hey, hi Michael.
Hey there. Can you see me okay? Great, okay, thanks for that overview, Jess. Really managed to cover a lot of ground in a short amount of time there. Really impressive stuff. My name is Michael, as Adrian mentioned, and I'm going to be talking to you, along with my colleague Kirit, about some remote and digital engagement approaches. So those some elements of the lockdown have been relaxed. It's still extremely important to maintain social distancing. So with that in mind, we thought it was most appropriate to spend some time today focusing on ways of engaging with communities at a distance, be that via the internet, by telephone, or using printed media. Can we go into the next slide, please, Adrian? So first up, we're going to suggest a definition for broadcast approaches and discuss how and why you might use these. Then we'll move on to talking about more involved engagement methods that support a greater amount of interaction between community members. After this, we'll reflect on how you can try to reach new people without having to head out into communities to meet them face to face. Then finally, we'll take a look at an example of one of our organisational cancer champions doing a great job of adapting to remote engagement approaches. I think he might be in the audience today. So I'll hand over to Kirit now to talk us through some broadcast approaches.
Thanks, Michael. Okay, so in terms of broadcast approaches, sharing information from a single point or organization is usually one way, but usually not as effective, but it's useful in reaching and engaging with lots of people with a single action. There are many different kinds of broadcast approaches, and many of you might be familiar with them already. So putting content on social media, uploading resources to your website, running email on your website, running email campaigns through tools like MailChimp, sharing WhatsApp lists, producing radio shows or podcasts, and simply sending stuff through the post. These are, the most important part of this is that producing interesting and engaging resources to support your communications and your communities. Easy read formats. And so, these broadcasting approaches are, will support other engagement that you might be doing. Next slide, please. Next slide, Adrian. Yeah. In terms of social media connecting approaches, there are other approaches you could adapt. And so that's around how you engage with social media by bringing communities on board, like using onto online spaces, by hosting online events, setting up telephone chains. Combining one or more of these would help to build stronger relationships and connections. As a guide, it's very important to bear in mind that these approaches are, you've got to try to create more like face-to-face interactions, and which are more powerful and in building relationships. Mike will now look at others more of these approaches in more detail.
Yeah, so another way to build connectors online is to create online spaces for your community members to engage with one another in. There's lots of different tools and platforms in which to do this, each with their own set of advantages. It's worth thinking about which platforms community members you're trying to reach already on, because this will lower the barriers to them engaging. In most cases, this is likely to be WhatsApp and Facebook groups. You'll need to think about how you can bring community members into these online spaces and ways of initiating and facilitating conversations between those who are present. Can I have the next slide, please? Sorry, I've just done that, so I could get the next slide again. So for many, text-based messaging and limited voice calling, as you can have on these online spaces, will feel like quite a poor substitute for face-to-face contact. So hosting online events using group video calling platforms such as Zoom, which we're on today, and Google Hangouts are perhaps the closest we can come to coming together in a group while remaining socially distant. When using this method to connect communities, you might want to consider incorporating an activity into the event. This both helps add some structure to the event and also acts as a draw for community members. Some ideas for activities which can work well for this format are quizzes, cook-alongs, exercise classes like yoga or circuit training, dance classes, karaoke nights, bingo, film or book clubs, makeup tutorials, talent shows, religious services. The possibilities really are endless, so you can get creative with it. Any of these activities can be used to engage attendees around issues such as cancer screening, signs and symptoms, and signing up as cancer champions. Simply break up the events with more serious interludes. Try hosting these events regularly to help grow your online community. Answer Cancer is able to support you in developing these skills. So talk to myself or Elizabeth if you want to find out more about that. We'll look at an example of how one of our organisational cancer champions has been doing this well a little later on. Telephone chains are another good way of getting people connected. Telephone chains are like chain letters, but use phone calls for communication instead. To initiate a telephone chain, just call people in your network to check in with them and share some information. For instance, the latest developments on the reintroduction of cancer screening programs. During these phone conversations, ask those you call to pass the phone call forward to several other people in their own network and ask them in turn to do the same. This way you can cascade information widely through your communities. They can be effective in reaching those without internet access and support one-to-one interactions, which many people can prefer. Back to you, Garrett.
Thanks, Michael. Okay, so in terms, next slide, please. Right, in terms of reaching new people, the most important thing is that some of these already, they rely on an existing relationship for that engagement. So you've got looking at a few of these other ways of trying to reach new people. Again, social media is a good way for making initial contact. So using public posts and through existing online communication groups, sharing information with their consent. Again, asking people that you've engaged and to do something similar for you, and something like a vox pop, and saying why they've signed up as a cancer champion. So video, please.
Sorry, we can't hear that. Could you get the sound on, please, Adrian?
Cancer champion. I became a champion because I wanted to help my community in raising awareness on early detection and prevention. Why not join me and become a champion?
Great. Next slide. Yeah, so in terms of, thank you, Vito, from that's for Mark for doing that short video for us. It gives you examples of social distancing. There's another example of whereby you could deliver leaflets in your local area, practicing safety measures in place. So building relationship is key to all of this, and that part of it is that linking up with other organizations and sharing and helping to share the information and signposting to opportunities and services is going to be crucial in terms of reaching new people. And finally, next slide, please. Next slide. That's right. This is a case study from Everything Human Rights. It's an organization that's been working in Wigan. We supported the first round of grant funding. They've used very creative engagement sessions, and they hope organize a very successful sports FIFA event with parents and their children and their young people. So Everything Human Rights is it's an important organization in terms of that it works with the African diaspora communities, including many refugee and asylum seeking families. And so since lockdown, they've been conscious of how to engage and maintain those relationships. So they've moved most of their sessions and services onto online. This is included, through via Zoom and so on. They've engaging work through coffee mornings and quiz nights and Afrobeats dance contest, which had up to 83 contestants. It's almost like thinking about the fun and casual events that you could organize with the added element of serious and more important information that can be shared. They use coffee mornings to sign up people to move towards the Answer Cancer training sessions that we organized through Elizabeth. With Elizabeth. And then finally, it's just conscious of that the success is based on marketing and about using the online events and using social media to build and develop those relationships. And they've done that quite successfully with Red Cross. Again, the opportunity is that to utilize online activities as a way to develop new skills, but also recognize that some people might not have that access to that information or mobile data, and they're prepared to pay for those mobile costs so that people who can't afford it can access it. And I would like to thank Farah because he's been fantastic in giving us his top tips, and he's kind of gave us some kind of these top tips in terms of engaging with people around remotely. The first top was that it should keep it simple. It's confusing for first timers, so offer one-to-one instruction over the phone, simple text reminders. Before you do your online events, to remind people that the events are happening. Ideas come from their local people and from the young people themselves. So share those ideas, listen to their ideas in order to do events. And finally, to really think about that online events are daunting, and they can be as we experience it now, but it's worth it if you stick with it and move on with it. And finally, there are other advantages that we all now kind of recognize, is that, there's no travel time involved, and financial costs are really, really reduced. So thank you to Farah for sharing for all of these wonderful tips.
We go on to the next slide, please. Great. So this presentation's been a real whistle-stop tour of different socially distant engagement approaches, but we hope that it's been of some use to you and has perhaps provided a little bit of inspiration about how you can go out there and do some of this stuff in your communities. We appreciate that a lot of ways of working that we've had to adapt to since coronavirus are new to many people. So Answer Cancer is committed to providing support and training to any individual organisation interested in sharing messages on cancer screening and early detection. So this training covers everything you need to know about cancer and cancer screening, and all of the skills you need to become an amazing cancer champion and an accomplished online engagement worker. So we particularly encourage our recent round of grantees to sign up for this training. But as I said, it's open to everybody interested in getting involved. So please do sign up to that. There'll be more information to follow on that after this event, I'm sure. That's all from us. If you've got any questions, then please do ask them, and we'll do our best to respond to them now.
Hi, thanks ever so much, Kiri and Michael. That was great. Thank you. We have had a few questions for you. So please take, whoever wants to take the question. Is it possible to access any of the resources that have been produced for the digital champions? So that's from Jack.
Hi, Jack. Yeah, of course, the resources we're developing, obviously we're developing them, so we will hopefully have more and more of these resources. We want and support any activity that's happening in the community. And if that means, accessing resources that will help and make that happen, of course, we're welcome to share it. Yeah.
So how will Jack get them? Should he email you? Would you email Jack? How will that happen?
Yeah, if you could email us at info@greatermanchester. Sorry, I forgot the email address, but yeah, I'll just email the email address at info@greatermanchester Cancer Champions, I think it is.
CancerChampionsGM.org.uk.
If we could put the link in the chat box or somewhere, that'd be great for Jack.
Yeah.
I would add to that, Jack, that a lot of the content of the presentation that you've just seen is in a YouTube video that we've produced to support groups with digital engagement strategies, which is on our YouTube channel, which I think we can get a link to for you in the chat, or perhaps we can send it in the follow-up for this event.
Okay, thank you. Next up, from Ruth, how do you become a cancer champion?
That's a great question, Ruth. There's a sign-up form on our website, which is cancerchampionsgm.org.uk. When I'm not speaking, I can't multitask, sorry. I'll type that link into the chat box for you. You'll be able to access it. And then once you're onto the website, if you click Become a Champion in the top right-hand corner, then that will take you to a sign-up form. And there's a sign-up form for yourself as an individual, but also you'll see when you get to the page, there's also the option of signing up an organization as well, if you click a link from that page. And once you've done that, myself or Kirit will be in touch to provide support and help you get going with some Cancer Champion activity.
So last up, thank you very much for answering that. Thank you. And thank you, Ruth and Jack, for your questions. Last up, I'm not too sure whether this is you guys or this might be the engagement and awareness team. It sits between both of your work. It's from Chiman Taylor, and they say, I'm a trustee of Bolton Hindu Forum. As we are aware that a big number of people are not accessing the NHS, particularly the BAME community, their conditions are likely to get worse. The Bolton Hindu Forum has recently launched a community radio. Our chairman has been running the 24 hours radio station live for 2 hours from 8 AM to 10 AM. Is there any messages we can broadcast to our listeners? The radio has a worldwide following of 100,000 listeners, which is fantastic. And Bolton Hindu Forum radio can be accessed via Facebook and downloaded as an app. To follow up, are you able to post messages on the radio? So that might be you that would do the radio stuff, Martin, or the engagement and delivery team. Jess has just popped up. Jess, are you going to answer that?
Yeah, I was going to say it's definitely something that will take up the really kind offer, and we can actually appear on your radio show if you like. I will nominate one of the team to do that. That's a really good opportunity for us as well. Thanks very much. We'll contact you outside the meeting. Thank you.
Okay, so we're going to contact Chiman outside the meeting.
Yeah.
Fantastic, thank you. So, okay, so the rest are not just at the moment. So that's it for now. The rest will come to the rest later. So if we've not answered your question at this point, don't worry, I can still see it. It's just that it will fit somewhere better later on. Thank you very much.
Thank you, Elizabeth.
Brilliant. Thanks, Elizabeth. Thank you very much. And thanks, Michael Kirit. That was really useful. Thank you. Okay, so we're doing quite well in terms of time. Next up, we have Audrey. So Audrey has very kindly come to share kind of an overview perspective of what's going on across Greater Manchester with the screening programs. So Audrey, are you around?
I am.
Brilliant, right, and camera as well, excellent. So I'll leave you to introduce yourself. Thanks, Audrey.
Thank you, Adrian. Welcome everyone this afternoon, on such a sunny afternoon. I'm one of the screening and immunisation managers, and I work for the partnership on cancer screening and improving uptake and reducing health inequalities. So if you could go to the next slide, Adrian. Thank you. So we have 3 cancer screening programs in England and in the partnership. And the first one is bowel cancer screening. Now, it's really important to understand that we've had bowel cancer screening for over 10 to 12 years. And we had an original test that was a 6-slide test. And it had to be undertaken over several days. Now we have a new fit test, and you may be able to see in the bottom right hand corner there, this has changed from having to do 3 tests to actually an individual test. So it's much more acceptable. So many of you might have had an invitation to take part in the old test, but actually this is much easier and acceptable. So we're hoping that as this is rolled out to the population, more and more people will be taking part. And the other important thing is that this is much more sensitive. So before the previous test, maybe if you lived in Bury and you enjoyed a black pudding, that sometimes gave a false positive because it was blood from another animal. Obviously it doesn't apply to vegetarians, but it did for some people, and so it gave us more people who were having abnormals actually who didn't need to take part. And we're inviting people 60 to 74-year-olds, but also if you're over 74 you can still opt in. Some of the barriers that people are finding about taking part is then the level of knowledge around actually, if I do take the test and I do have an abnormal and it goes and I go on to need some treatment, historically, I think people were very frightened that actually it was a very invasive procedure to have some of this assessment and treatment. This is radically changed. So I just want to dispel any myths around that. This is so easy to treat. So we don't want that to be a barrier, and we want you out there who have the ability to change and inform people that actually we don't want that to be some reason why you don't take part. And then also the fact that actually when you're taking the test, that this is the first element to understand whether you have an abnormal. And then part of that test, next part, is that you then may be asked to take part in a colonoscopy. And that's a procedure that looks at the whole of your bowel to ensure that if there are any polyps, which are elements within the bowels that aren't cancers in themselves, but may well carry on to mutate into a cancer down the line. And so if you're in the communities, if you're able to explain that, then actually, because people understand what the next part is, because we have some people in Greater Manchester who are doing the test and seeing the nurse, but then not carrying on the rest of the pathway. And it's so important that actually you follow this through, and the things that are put in place to ensure that you are walk through this process with the nurses, and this bespoke approach will give you confidence around this. And then also it's historically been around fear and embarrassment, in that actually none of us like to talk about, and I'm going to use the word poo, and there's various other words to describe it, but actually why would you not want to do a small test that's a one-off at a time when you might go to the toilet? You straight away can pop it in an envelope and it will go off to a hub who tests these, and your test comes back normally within 14 days. So don't let that fear and embarrassment about dealing with something that's every day, and particularly if you've been a parent, you've dealt with that everywhere with the child. So we want to try to get people in the community to overcome that. The other element that is very pertinent at the moment, and I think you'll all be waiting to hear around, actually, since we've had the start of the pandemic at the end of March, how's COVID-19 affected for bowel cancer screening? And I am able to tell you, because I'm at the forefront of working with our providers around this. So in terms of the bowel, there was a point right at the beginning where individuals who were clinicians and nurses were asked to support the COVID-19, and so that did mean a pause in the delivery of the bowel cancer screening programme, but only for a short time. Now, the 3 programmes in Greater Manchester are starting to work through some of the backlog in the programme, and you'll be reassured to know that that means they are looking at the high-risk people first, and those individuals will be invited to take part. What I would welcome your help in trying to reassure people that actually everything possible has been put in place to reassure their safety around COVID-19 in coming in and taking part of the pathway, as it is for the staff who are going to deliver this programme to you. Because on all 3 cancer screening programmes, we are hearing that some of our public in Greater Manchester who need to come in and take part in this are feeling very, very reticent about taking part because of their COVID concerns or maybe their shielding. Let me give you some reassurance. We would not let the programmes commence if we thought there was any risk to you as individuals, and we have spent a large amount of time, and there's PPE and all the processes have been put in place to ensure that this is a safe environment for you to be in. So we really do want people, first of all, to take part in the kit when they receive it. And then if they do receive an abnormal result, please encourage people in the community and the public to carry on that pathway and contact the programme. They'll be given details, because the programme also want to give you reassurance. And actually, if you're at a moment in time when you feel actually this isn't the time for me to complete, they're quite willing and able to put you on a list, and so you're not going to be, oh, you've DNA'd. They want to retain these people, and they will come back and talk and see how you feel down the line, because you may be in a shielding group. So can I give you that assurance around that? And that's particularly for bowel cancer screening. So next slide, please, Adrian. Breast screening. The invitation is to women 50 to 70-year-olds, but in some areas of GM, there are trials around the 43 to 73, and that's because the trial's been looking at whether actually do we need to invite people a little bit earlier in order that they receive an invitation at 50, because people are invited every 3 years for breast screening. You can also opt in if you're over 71 and you've been through rounds of screening, or if you've never taken part and you suddenly feel, actually, this is for me, you can opt in there. The barriers around breast screening is that breast screening of our 3 cancer screening programs we've had for quite a while within the NHSE, and we need to raise the profile of breast screening, because I feel like it's lost its way a little bit. Other things have come at a higher profile, so I would welcome your help in this, in raising the profile that all women should take part in breast screening. Unfortunately, in some of our BAME groups and in deprived groups, people don't always have that understanding knowledge of why they should take part. And also for some of these groups, they may have challenges around access, and we need to understand some of that. So if any of your groups or individuals are thinking of doing work, we would also welcome to know if there are particular pockets within GM, and you'll know that better than we do, where we need to put something additional in. And also, we've been tasked with providers to putting things in place that help identify what these groups might need as additional help, you know, particularly around learning disability, physical disability. And with breast screening and other cancer screening programs, the partnership and our team particularly are really keen that we don't just increase in the uptake of cancer screening programs, but we don't want to make that gap bigger between the GP practices that are really high of people taking part, and yet we've got really low. We want to narrow that gap, and in narrowing that gap, this is probably going to be the people who need to take part in this screening more. In terms of breast screening and how COVID-19 has affected it, similar thing to the bowel. You've got highly competent radiologists and surgeons and nurses, and some of those did have to go away and work on COVID within acute trusts. But even while that was going on, we still managed to, and the programs managed to deliver for the high-risk women. So if you're identified when you've been taking part in screening that you're in that high-risk group, you will be offered a screening every year, and that has continued around that. So work is being currently put in place for the breast screening invites to recommence. So this is about recovery, rescheduling, but making sure it's gold standard safety for you as individuals to take part in screening. And then should you need, and often that takes place in a community setting, but then should you need to come into an acute trust, that you have full confidence that everything has been put in place for your safety and the staff's safety. So next slide, please, Adrian. With cervical screening, this never actually paused. However, in some of our GP practices, because of COVID and and what came out of that, that wasn't always to be facilitated. So we are inviting the 25 to 64-year-olds, as you can see, 25 to 49 every 3 years, and then subsequently every 5 years. We don't invite before 25, and there has been a lot of trying to sort of influence around this in social media, is that actually sometimes with some of these HPV viruses, which is what we're testing for now, not cytology, some of those viruses that you have when you're younger will mutate and they will disappear. So actually, if you test too early, sometimes you're treating and that can be invasive when actually you don't need to treat. So if I can dispel that myth. And so we are testing for HPV, which is a much more definitive test. And don't forget, we're not looking, this isn't a cancer program. This is to get this early signs that you can either treat or be aware of that may then go on. But this isn't looking for cancers. This is early diagnosis. Your letter will come from your GP, but sent by a host organisation, and you need to make that appointment. And for a lot of women in GM, particularly in that younger age group who might have undertaken the HPV vaccination, there's a bit of a lack of understanding of whether they need to take part, despite being vaccinated, and this will reduce your risk of HPV. You still need to undertake some cervical screening. So we need, if you're able in your communities and with some of the younger age group to dispel that myth and have some dialogue and have a chat around that. And there's lots of materials around that to support that, particularly by Joe's Trust. And you may have seen that in the press because it was Cervical Screening Awareness Week last week. So there's a lot on social media, and I know Answer Cancer will be able to help you around that. So yeah, we don't want you to be confused around whether you should take part or not. Embarrassment, is a factor for some people, but what we're saying is, you know, a lot of you are putting yourself through other what I would call things that you might go to beauty salons for, but which is just as painful. But why would you not want to take part in this? This is possibilities to finding something very early and to saving lives, and health inequalities as well. Obviously, for some groups, it's very difficult, and they have a lot of issues of why they might not want to take part. Please can I ask you as in communities to do some work around trying to dispel this, and where maybe we need to do bespoke elements around in GP practices where you don't receive your results direct with an envelope. You can have it through a text if you'd rather not, because of where you might be living. You don't even have to go to your GP. There are other alternatives, because you may feel that's not appropriate for you. And so the COVID-19 has affected it slightly, but we know that this cervical screening program is up and running, ready for business, and why wouldn't you want to take part? Next slide, please, Adrian. And this is my final slide. I think in conclusion, I'd really like to say we are looking at focusing on interventions that can have the greatest impact. And we've done a lot of work in Cancer Vanguard work, which defined what are some of the key things. And that helped focus on why we've got Answer Cancer and why we've got the cancer screening improvement leads. But what's really key is we have to work in a multifaceted way, and that's, you can have national things, you can have invites, but actually what we found with the Cancer Vanguard work is we need that discussion on the ground. We need to raise the profile that actually, why are we not talking about cancer screening in a more everyday approach like we would do other things? And really, I want to put the mantle out to you that can we try to change that with Cancer Champions and our discussion that everybody should be talking. Oh, you're in that age group. Have you had your cancer screening? Have you been for breast? Because actually, in saying that, you might help dispel myths and help work around what those barriers may be. And even more so with COVID, we're hearing from our bowel screening programs and within the cancer screening environment and cancer screening environment within the trust, that people, even though they may even have an abnormal result, are really worried about coming into trust or into community settings. And we need you to dispel that actually we are taking the utmost care to ensure that everything, every element of PPE, every element of interaction and where that can be done on Zoom or extra telephone calls and explaining what that might look like. Please don't not take part. The programs are there to help you. So even whatever worries, please encourage people to come forward to the programs to share those worries. And maybe then that we can ensure that we don't have people who are in this group who haven't probably taken part for a little while, and now there's an opportunity, and we want them to grab that opportunity because their lives are at risk, and we have everything ready now for people to take part.
Audrey, brilliant. Thank you very much. We've got time for some questions now, so I'm going to hand over to Elizabeth. Elizabeth, do we have any questions for Audrey?
We have a lot of questions. So thank you very much, Audrey. That was really great. Thank you so much. And thank you to everyone who keeps posting the questions. I'm going to ask and hopefully answer a few now, and we'll get round to answering the rest later. So you've already touched on some of these, Audrey, during your presentation, but I'll just ask them again so people feel like they've got the answer that they want. So first up, we had a question from Jackie. Jackie said, cancer screening has been very much slowed down during the coronavirus outbreak. For example, colonoscopies are not very safe and there is now a long backlog. Also, investigations and treatments for people with possible symptoms of cancer have backlogs. How are Answer Cancer's messages, so Jess, we might want to do this, being adapted to these circumstances, and how are the team offering support to members of the public who are anxious about these circumstances? So I think you answered part of it before. And
I did. So where you said colonoscopy isn't safe, it is safe now because everything has been put in place. So I just want to make a point that we will not be able to see the number of people that we previously saw, and that's to ensure that there is decontamination after every person, and that and all the PPE is used. So it is safe, and that has gone through rigorous checks and signed off from Gold Command in Acute Trust to our commissioners and myself. So that is safe. I think what's important is around for individuals, if they're actually already on the screening pathway, I would welcome them to approach the programs direct, because they will have those contact numbers, and don't feel that they haven't got the time. All these programs have got extra people on specifically to take these calls, because they do understand that people need that additional discussion, and it might be more than once. They might discuss it. People might go back and talk to their family and friends. So this is open for business, and we need to do something. This is now bespoke for COVID. Can I reassure them? But I think as well, your program can also do that general reassurance as well, Elizabeth.
Thank you so much. We've had a question from Erima as well, but I think you've just answered Erima's questions, because she said, hi Audrey, what did you say about COVID-19 and the connection or not on bowel screening, which you've just answered. Is it safe? And you've answered that.
Absolutely.
So if you've got any more questions, Erima, keep them coming. This is a question from Coral, and it's for Jess, if Jess is still online. If Jess has gone, Adrian, you might want to step in here. Coral's asked, Jess, Audrey, what data is available to show that health inequalities are being addressed and the impact on cancer screening uptake?
Or did you want to start?
Yes. Coral, I don't know. In terms of, we have a new analyst who is working for our team around identifying the data, and we are aware that there's new elements of data coming in, so that identifies down to a GP practice level, Coral, and in terms of then deciding who needs in terms of GP practice, where that work needs to take part, but then also in terms of localities, because it just isn't about GP practices, I've mentioned earlier. So we work very close with Jess and her team, and they have access, because you've got access to Tableau, haven't you, Jess? I understand.
Yeah.
And there's going to be a new data source regarding that as well. But also, Coral, we've got some cancer screening improvement leads, I think, who are on, and they're really keen to do work, because we've tasked them as part of commissioning to undertake a health equity audit for all our bowel and breast screening programs, and they want to also work with local authority public health analysts, because you will also have some of that really sort of low level information around some of those groups and people identified within those groups. And so I think it's sort of a multifaceted approach, from a primary care to a practice level with a community development approach, but that's how we're identifying where to target that work. Does that make sense?
Yeah, I think as well, to add on top of that, we also have an equality impact assessment, which we make sure that we're addressing issues that have issues that may be affecting sectors of the community that we need to address in our delivery of the service. So we make sure that we're inclusive in our practice as well. So we not only look at the information that's available and look at what gaps are there, but we also build on our knowledge as a team and information that we get from communities as well. So and we work in partnership whenever we can as well. Audrey's already mentioned the cancer screening improvement leads and Greater Manchester Health and Social Care Partnership. So we're not working in silos, and I think that's the most important thing is that we're trying to all work together on one big plan to move forward. And I think, you know, some of this we can see in the work in Manchester. That we're trying to target some of the areas where there's the worst uptake in screening and the worst outcomes as well. So we're utilising whatever we can, really.
And can I just add again, the health equity audits will be key.
Yeah.
And also because they will be a physical tool that you can take to CCGs, you can put to health and wellbeing boards, it raises the profile, it creates discussion. But then we also need a combined approach from public health, local authority, because you have some of that data as well. So if CCG leads can be a catalyst to helping the anti-cancer or CSILs around that, that would be very welcomed.
Thank you so much. Thank you. Adrian, have we got time for one last question, do you think?
So, Elizabeth, what I was going to suggest now is so that we just move on to the next section, which is about making a plan. And if we get that done in maybe 5, 6, 7 minutes, then we'll have time to come back for some questions, a few more questions towards the end. So just to say, if there is a question that somebody has asked that you think is important, give it the thumbs up. And that means Elizabeth will come to that question first. Otherwise, we'll take them in chronological order. So if we now go on to the plan bit, is that okay, Elizabeth?
Brilliant, thank you very much. And thank you very much to all those who posed a question and to the ones who've answered it, thank you. Okay, so, hello again. I've been doing the Q&A most of the morning. My name's Elizabeth, I think you've gathered that by now, and I'm the training and development worker for anti-cancer. And today it's my job just to talk you through the making a plan section. Some of you have done this before, so if you've recently been on any of my training, you will have done this before, but it's still something we'd like you to do again. At Anti-Cancer, we like anyone who takes part in any of our events, training events, to make a plan to share the learning that they've had on the day with others, or a plan to develop their own skills and knowledge in cancer awareness. So this is something we'd like everybody to participate in doing. But don't worry, I'm going to talk you through it. So here's how we'll do it. On screen, there's a number of bullet points with suggestions for plans. Just take a moment and have a quick look at them. You don't have to do any of these. You can make one up of your own. You can be as creative as you like, or keep it as simple as you like. So here's how we're going to produce our plan. We're going to do it in real time today. We've already created an online form for you to use, and we can access it in 2 ways. So for anyone on the laptop, you can access, and with a smartphone, you can access the plan that way. Simply open up your camera on your phone and point it at the QR code on screen. Make sure you position it with all the 4 corners of the code in view, and it should open up into a website form. Okay, for anyone using a smartphone or who's a bit more old school, they can click on the link in the chat box. So I think Adrian's already put a link in the chat box. So now you've decided how you're going to do it, we'll do it together. So let's click through. Don't worry about leaving me here on this page. You'll still be able to hear me. And once we've completed the plan, we'll come back here. So we'll just take a couple of minutes to do this together now. So if you click through, however you're going to click through, or you've opened on the QR code, that'd be great. So now we should be open on the first page of our plan. Okay, are we all there? The first bit is some blurb about how we store your information and what the plan will be used for. It explains that we'll connect with you again in 1 or 2 months' time to see how you've got on with completing your plan. That's if you want us to, and you give us permission to contact you again. And please click OK once you've read that. Next up is your name, your email address, and what date you came to the stakeholder event, which is today's date, the 24th. It should actually open up on that page. On that, click next when you're done there. The next screen, question 4, what are you planning to do as a result of today? So hopefully you've got your answer, you've thought of something, you can put it in that box. If you have a little bit of, if you're struggling a little bit with this, and none of the suggestions or the bullet points before stood out to you, and you'd like to take a bit more time, or you just can't do it here, right now, don't worry. This isn't designed to cause you any stress. Do as much as you can here now, but then when we go back to the main session, you can, at the end of today's session, leave that page open and you can go back to it once you've finished. Okay, for those who are managing to keep up and I've thought of a plan, that's great. So question 5, when will you do it? That's this week, today, next week, next month, whatever. Okay, what do you hope will happen as a result? So click write in your answer if you've got time to. Okay, and then click next when you're done. On the next screen, it says, are you happy to be contacted? And that'd be great if you ticked yes. That means we can follow up your progress and report back to our commissioners, just to show that the anti-cancer message is getting out there into communities and that cancer awareness is spreading, and because that's what we're about. We want people to be aware of cancer, the early signs, symptoms, preventative messaging, and just get that awareness out there. So when you're done, just remember to click finish, and that's it. So even if you finish that or not now, I'll give you 2 minutes and then we'll come back to the main session. Okay, just for those, just take an extra minute or so. But like I said, don't worry if you can't finish it, you can come back to it later, but be sure to finish it. Okay, we'll give people 1 more minute, I think, till 14:08. If you don't finish it in this session, like I said, be sure to finish it once the stakeholder event has finished, because it's an important part of our work, and it's what we do to demonstrate it's what we use to demonstrate our impact. Okay, so park that there now, come back and join me in the main section, and thank you so much for all those who took part. I understand it is new and it can be a little bit challenging, but thanks to those who've had a go, and that's great. Thank you. Thanks, Adrian.
Brilliant. Well, don't go, Elizabeth, because you're back on, and potentially any or all the panelists. So we're back to, we've probably got time for about another 2 or 3 minutes worth of questions.
Okay.
I see people have given the thumbs up to the ones that we can answer. The ones we can't, we'll send out a Q&A sheet. So we will answer every question. So do all the panelists want to come back up now?
Okay, so I'm going to select a panelist to answer who I might think will be best answering, okay? So the first up, Adrian, can you supply partners with the video clips of the 3 cancer screening tips?
So yes, so we've got access to some videos from a variety of different partners. We've also got videos we're producing ourselves. If you send us an email, or we'll have your details, we can supply all of the things we've got and links to different places. Yes. Okay,
and again, you can answer this one, Adrian. Will we get access to these slides, to the slides that we've seen today?
Yes.
Okay.
They'll be emailed out.
Okay, so Jess, let me just find the one that just you. How do we access the resources to support those who have received funding? We've just got a few to go through as well, Jess. So
you, is that for people who've actually had funding from us?
It sounds like it is. Yeah. How do we access the resources to support those who've received funding?
You'll get a pack emailed out to you, and we'll send out some actual resources if you need. Your goodies if you need.
Okay, thank you so much, Jess. So let me just click that as done. Adrian, you'd probably be best to answer this one, but I'm just mindful of time. Are any cancers preventable, and how? That's a question from Deshayon. Thank you for Deshayon.
Your risk of cancer is significantly increased by things we can't change, so things like age, but you can control your risk of cancer by lots of different things like behaviour change and lifestyle choices. So the obvious ones include things like smoking, healthy diet, exercise, excessive drinking. So rather than go into that here, part of our training offer goes into some detail about the signs and symptoms of cancer, about the screening programs and cancer prevention. So looking in detail. One of the questions I see that Jackie, who's one of our cancer champions, Jackie has actually typed in a really good answer to that as well. So if you look at the Q&As a wee bit lower, somebody's typed in some useful information.
You can look at our website as well for more information.
Thank you. Ash has also asked the same questions, can any be prevented? But yeah, I think you've both just answered that one, so that's great. We've got one from Cedric, and this may be for you, Audrey, but we're just mindful of time, okay? So is there a need for self-isolation before follow-up bowel test? So if you've been asked to go for a follow-up bowel test, do you need to self-isolate beforehand?
Yes, for some of our programmes, if you have an abnormal test and you're invited for a colonoscopy, then you may well need to self-isolate in order to protect the staff and to ensure that you then. So you'll be asked to isolate, you'll be tested when you arrive, and then to ensure that obviously there isn't any risk to either staff or yourselves because you may be having symptoms. And so that is at this moment in time, and can I make a point of that? As things change, that may change. So that isn't set in stone, but that's currently for some of our programmes, yes.
Thank you very much for that, Audrey.
And can I just add to that, although it is a period in time, if you think what is 2 weeks self-isolating to ensure that actually if you do need some treatment, you are seen in a timely way. So it's probably frustration and you might not want to, but the ultimate gains are huge, aren't they?
Yeah. Thank you so much, Audrey, and thank you to Cedric for answering that. He's also asked another question. He said, I have a forgotten C Zoom meeting with my MP. So I'm assuming forgotten C is the name of the meeting. Anything he can do to help, anything he can put forward. So he may want to contact Michael and Kirit later and see if they've got any messages that he can pass forward in that one. Would that be okay, Michael, Kirit?
Yep, that's fine.
Yeah, absolutely. Please do get in touch, Cedric.
Brilliant. Brilliant. Thank you. So I'm going to class that as answered. Sorry, I'm just trying to get through as many as I can. Someone said, is anyone going to talk about prostate cancer? Not somebody, sorry. Gloria said. She's already received an answer, but do you want to give her another answer, Adrian?
I think it's worthwhile just reading out for the benefit of others who can't see it. So the question about, are we going to talk about prostate cancer? So obviously Answer Cancer, GM Cancer Screening Engagement Program. So obviously we focus on the NHS cancer screening programs of breast, bowel, cervical, and there is no national screening program around prostate cancer. But Donna has given a really good answer to say Donna's part of our engagement and delivery team. And Donna quite rightly reminds us that we can deliver information around prostate cancer, even though there is no national screening program. So we know that there are higher rates of prostate cancer amongst some of our communities, Black men, for example. So we haven't spoken about it today. It's definitely part of our offer for communities as well. And there's obviously some crossover messages. If something's not right for you, then if you've got signs and symptoms, go and see your GP. That's true across all of the cancer types.
Thank you so much, Adrian, and thanks, Gloria, for the question. And we've had some great questions today. We've got one last question, and this is for Jess and Audrey. But we're very pushed for time now, so I'm just getting that out there. So the question is, it's from Coral, and it says, Jess, Audrey, what data is available to show that health inequalities are being addressed and the impact on... Did I answer that? Did we ask that one before?
Yeah, we've done that one.
Sorry then, we've already done that one. She did ask another question of you, Jess. Oh, sorry. Jess, when do you think we will start to see a change in cancer screening uptake as an impact of all the training and community engagement?
Well, I think one of the big difficulties is that we were starting to see an uptake, but with COVID and the lockdown situation, I think the world has really dramatically changed. So I think it's going to take a while for systems to settle down so we can actually look at numbers. We know that there's been a huge decrease in number of people who've actually accessed screening, and we know that probably from this there'll be an increase in numbers of people having cancer symptoms, and until systems and services return to normal, it's a bit of a wait and see game. I think we're trying to stay on top of data when it comes through and look at the impacts of what work that we're doing, and trying to be creative in the ways that we're engaging with people. And
just to say, I suppose there's a slightly different answer around being able to demonstrate impact. So we've got an evaluation plan, evaluation methodology as part of our performance monitoring. As part of our job to make sure that we have a summary evaluation at midpoint across the year, as well as a deeper dive at the end of each year. We follow up, for example, grantees within 2 months to understand the impact of their kind of receipt of funding and how it's been used, and kind of so on. And there's a mixture of qualitative and quantitative approaches as part of that. So it's a slightly different data question, but the answer around we are keen to demonstrate impact in a variety of different ways. So we can talk to you kind of more offline about that if you'd like to as well, Cora.
So we've just got one last question, and because we've done so well and we've got through them all, I just feel that we should just answer this last one. So again, I'll throw this out. Anybody could answer this. It's really for our engagement and delivery team. So if any of those are online, oh, they can't speak, so they're not the panelists. So it says, Roshonara has said, Bolton Council of Mosque represents the BAME community. Are there any champions who would come and deliver workshops to raise awareness on site? So champions or workers.
Just answer that, Elizabeth, if that's okay.
Perfect.
Yeah, I have been talking to the Bolton Council of Mosques, and they are really keen to work with us. I think because of Ramadan, it was kind of felt not appropriate, but so much that it was more priority for them to focus around the fasting period. But now that we're coming out of that, and with COVID restrictions being reduced, so we will want to engage with that. And any champions out there who are in the Bolton area would want to work with me and Nana to go and do some of that conversation, that work over the radio or online or over Zoom. I'm more than welcome. Please let us know. Yeah.
Okay, so
sorry, Elizabeth, just to add to that, we've actually already done 2 awareness raising sessions at BCom as well. So we're really keen on building on that groundwork that we did for the women's groups there.
Okay, so can Roshanara contact you, Kirit, and sort it out?
Yeah,
so if you put your contact details in the chat box, that'd be great. Right, Adrian, I think we've answered everybody's questions, so thank you so much. Over to you.
Brilliant. So if there are any outstanding ones, put them in. We won't answer them online, but we will answer them offline, or you can always email. So can I have everybody's, all the panelists, can you all turn on your webcams, please? Just so when we say goodbye and we say thank you to everybody, just so that you're all there. Okay, so can I thank everybody on what's, it's a really lovely day outside. I've had to close the blinds in the office so that I don't get screen glare. So thank you all for staying with us, our first online webinar. Jess, do you have any final comments to make or any final points? I'd like to thank all the panelists, Audrey, Kirit, Michael, Jess, Elizabeth, for doing a valiant job on Q&A. Martin, who's been managing it on Facebook. I'm so relieved that we managed to stream to Facebook for the first time, so that's good. So
I was just going to say thanks very much for everybody who joined us today. I think this is the first time we've tried this in this format, and I think it's worked well. So thank you very much, and thanks for everybody who put questions forward as well. It is a very strange environment to be when you're actually just talking to your laptop without that engagement. So it's been really good to have questions from everybody. And again, thanks for all the panelists who contributed and all the tech support as well. It's been great. Thank you.
brilliant. Thank you very much, everyone. Have a lovely day. Go and enjoy the sunshine safely.
Thank you.
Bye all. Bye.
Bye.
Bye. Bye. Bye. Bye.